Thank you everyone for joining and welcome to this talk about will the COVID-19 inquiry deliver justice? My name is Ruby Lott-Lavigna. I'm openDemocracy's news and politics reporter, and I've been leading our coverage on the COVID-19 inquiry so far, alongside our amazing COVID reporters. We're really glad here at openDemocracy to be doing this talk because of how fundamentally important the inquiry is, and because of how it intersects with so many interests of ours: health justice, inequalities, transparency, honesty in politics, workers' rights. We want this conversation to involve you guys as much as possible, and particularly thanks to everyone who submitted questions and comments ahead of time. We're going to address as many of those as we can. If you're joining on Zoom and you have questions or comments for us, you can click the chat icon at the bottom of your screen and type in the chat window, and people watching on Facebook can put their questions in the comments. Of course, the talk tonight is about whether the COVID-19 inquiry will deliver justice. It's a question that's incredibly pertinent to almost everyone in the country, especially those who lost loved ones during the pandemic. I hope we can make a start at answering it and find a little bit more about what justice might look like to everyone. I'm really pleased about our panelists who are joining us tonight. I'll give them a little introduction. Fleur Anderson is the MP for Putney and Labour's Shadow Paymaster General. Fleur, I know, has a particular interest in the issues of the inquiry, and I'm very thankful she's found time in her busy schedule to talk to us today.
Thank you very much. Nice to be here. Hi, everyone.
Nice. Hi, Fleur. Dr. Saleyha Ahsan is a physician, journalist, and documentary filmmaker who's working as an emergency and intensive care doctor during the pandemic. Her father, Ahsan al-Chowdhury, sadly caught coronavirus and died. I've spoke to Saleyha about her experiences before, and I remember you telling me a quote. You said, "It was a very traumatic time. Then to learn that number 10 had been having parties, it makes me feel nauseous." So thank you so much for joining. I think your contribution will be incredibly important.
Thank you.
And thanks. And finally, Finn Johnston is one of our specialist COVID inquiry reporters. I will say his surname is Johnston, not Johnson, and has been there this week, in fact, listening to former ministers and experts give evidence. Finn has worked for us as well as the Bureau of Investigative Journalism. So thank you, Finn, for joining us. I know you've been there, so it's been quite busy for you today.
Yes, thank you for having me.
So as I said before, I have some questions for the panelists, and then we'll take some questions for the audience. Please, panelists, mute yourselves when you're not speaking, and feel free to jump in or whatever, add stuff if I've missed anything. So first off, Saleyha, as someone with a very personal experience of the pandemic, I kind of wanted to start with you. How are you finding the inquiry so far? Is it pleasing to kind of have this process begin and the evidence giving begin, or do you have quite a lot of concerns with the way it's kind of started?
So the COVID Bereaved Families for Justice had been campaigning very hard for this inquiry. There's a big preamble to this before we even had the start date on the 13th of June. Over a year's worth of working hard to push for this. So to finally get to the start date did mean something, but it was a bit bittersweet because we, as the bereaved, are not really included, frankly, in the way that we envisaged or in the way that we knew that other inquiries have involved the bereaved. We know this very well because of our lawyers. Brodie Jackson Cancer have represented Hillsborough bereaved, Grenfell, Manchester, so they know the inquiry world on behalf of the bereaved exceptionally well. So when you hear your own lawyer saying, this is not really going how it usually goes, that does raise alarm bells, really. And my concern is that, yes, there are a lot of us because so many people died, sadly. And my argument, and the argument of many of us, is that is a reason why the presence of the bereaved is even more important. Not we've got so many, so we won't have any. The point is you need to. And here's why. One reason alone, when you have vast, big numbers, like over 200,000 or 250,000 deaths, it's really hard to personalize each one of those, the best will of the world. You can, it becomes just like a mass of numbers, faceless numbers that really don't mean anything. But when you begin to look at each one of those lives, and then who is connected to those lives, both as loved ones, as family, as colleagues, as friends, it's a whole network. It's such a significant number that you just then begin to think, well, how much of the UK, the population, were actually connected in some way or other to everyone that died? So when you have none of those being represented or heard, let's say, to give their testimony, that for me raises alarm bells. And what traditionally happens in an inquiry, as Pete Weatherby, the barrister, has told me numerous times, are pen portraits, and they are something that the bereaved family member will do. They will humanize a person, demonstrate the life of that person in the inquiry room to the chair, so she gets a sense of the person who was lost, and gets a sense of what happened. And so as she's deliberating, she's got an account to draw on. At the moment, she doesn't. Yes, they have made attempts around this. They've tried every which way around this, from having little impact video at the start. I'm afraid I was there on the first day and I saw it, and I know people were moved by it, but I was actually angry because I sat there thinking, this is just a way around what should be happening. This is what this is. This is just, okay, we need to do this. How are we going to do it? I know, let's go and make a little video that was quite tightly edited and controlled. You know, I make films. So yeah, it was edited for content. Yes, it was powerful. And yes, the people involved were very brave and very grateful for them doing it. The other thing is every story matters, and every story matters is another way around it. Basically, that is anyone and everyone who wants to participate, and everyone should be allowed to participate. I mean, this is a public inquiry and it's for everybody who was affected by COVID. Practically everyone in the whole country was affected. So everyone will and should have the right to contribute and participate. However, the bereaved are not being treated in a separate group to this. So I spent most of the COVID pandemic making films, working. I was working. I saw it firsthand. I was alarmed by what I was seeing. I was alarmed by the delays in action from the government when it was really quite logical that to save lives, we need to act now. And they wouldn't. And you'd see Scotland locked down, you'd see other countries locked down, and then bringing up the rear would be England, with Westminster making its final statements on locking down. So it was all really blatantly obvious. And I spent most of the pandemic working and making these films, trying to demonstrate to people what's actually going on inside hospital. I made a dispatches very clearly demonstrating how horrific this is from a really sort of ground level perspective, with no other sort of barriers, filters, misinterpretations, because I know this job. There's no room for sort of misinterpretation here. I can show you exactly what it's like, as close to you being in the room with me. And also by arguing against the Google warriors who had suddenly become overnight experts in infectious diseases and outbreaks, who suddenly became experts on herd immunity and you know, whether we should or shouldn't be wearing masks or shaking hands. And everyone had a theory. So I spent many a morning talking on the various shows with me, who was clearly on one side of the fence, versus someone else who'd sort of become an overnight expert. So my point is, every story matters. The example is, I could be giving my account in the morning to someone on Every Story Matters, talking about what I went through with my father and how he caught COVID and how he during Partygate, on the day when Allegra Stratton was doing that infamous press conference, probably around about the time where we've just been seeing those horrific, disgusting videos of what was going on with Sean Bailey's Christmas party. So my dad caught COVID. Then I could be giving that account in the morning to a certain person from Every Story Matters. And then in that afternoon, that same person could be speaking to someone who said, well, actually, COVID wasn't real. Is that right? No, of course it's not. It's ridiculous. And I've never, in all my professional career as a healthcare professional, and even as a journalist, when I have dealt and worked, because I was a journalist before I was a doctor, the way you manage and deal and work with the bereaved is separate. It's separate. They have separate needs. They have separate requirements. And to not acknowledge that is, well, it's wrong, and at times it can go so badly wrong that could almost be cruel for the individual involved. So I know I've gone on, but this is a really important thing. And at the end of the day, we want to support Baroness Hallett in what she's doing. And finally, I will say this. Yes, we're in module 1 and it's preparedness. Our lawyers know what they're talking about. They know us all very well. We are not one homogenous group. We've all got different lives, different backgrounds, different perspectives and professionalisms. The lawyers put forward 20 witnesses who they felt would be relevant to preparedness, not just because we'd lost, but because we've got something to say on preparedness that would then help Baroness Hallett. Unfortunately, those 20 names have been rejected. Mine is one of them.
Yeah, it's really outrageous. I covered it actually at the time that you guys had kind of all had your witness requests rejected. And I think it's clear just from doing any reporting, speaking to kind of COVID bereaved families, for justice is how pertinent those stories are to every stage of the inquiry. You mentioned there a little bit about being on the ground and being there during the pandemic. This module is about how the UK prepared for a pandemic. At the time, how prepared did we feel?
Okay, and so this is the reason why Pete Weatherby, KC, has put me forward. I am more prepared to put on my nuclear, biological, chemical warfare equipment and my respirator and my gloves and my boots than I was putting on full PPE when I started the pandemic. I'm ex-military. So my analogy, and it was really quite my comparison, it was just so damn obvious. I'm a big advocate and a believer in the evidence-based work of simulation training and the importance that is in both individual and teamwork and service level. And in the military, we did it morning, noon and night. We trained all the time, and whatever the situation, training was a huge part of what we did. And NBC kit, putting that on, even though, I'm talking about the 90s, and I, for 10 years trained in that. And the importance was that you could put on that kit, which is cumbersome, uncomfortable, difficult to operate and work in. We trained in it all the time so that if we ever needed to put on in anger, we would still be able to be operational. Fast forward to when I'm a doctor. I was a doctor for 40 years before the pandemic hit, until the day I was actually standing outside the COVID red ITU. I had never put on that canister, the donning and doffing. I learned it on the job. And I thought, hold on a minute, that doesn't make sense. We've had no sort of training beforehand. So on how to put this on, take this off safely, and how to, not only that, how to be operational in it, how to actually do the job in it. You just have to do it. And you just learn about, oh, damn, I can't scratch my nose and my nose is so itchy. I'm going to have to really time when I want to go to the loo because I can't just take this off and go, there's a whole process. I'm going to have to time when I drink my water, all of those things. And can I actually stand here doing this procedure? My hands are so sweaty, everything's getting misty, and it's really hot. And I think I might pass out because it was the first time that we were doing some of these things. And I think when I reflected, I thought, crikey, all those years of training, all those all those simulation episodes and opportunities, and we never thought, it was never sort of put into the training program to do that. And you know, when I look into that, I think that, you know, again, that all these things come centrally, you know, and what we should and shouldn't sort of be training for. And we know, you know, David Cameron's told us about the 2015 National Security Strategy, where, you know, emerging infectious diseases and pandemic influenza, you know, were noted as one of the 6 tier 1 risks to the UK that, you know, we really needed to be alert to. But again, that wasn't taken seriously. And that wasn't, I don't know if it was taken seriously or not. I think at that point it was, you know, invest everything in Brexit or this, we can't do both. And, you know, they chose that, thanks. And, you know, and that is, you know, that's horrific. And it has contributed. I'm going to say something, and I haven't scientifically looked into this yet, but, you know, Brexit was sold as, you know, this great thing, and so many people voted for it from, you know, parts of the country that would never have voted, you know, blue before. But if you have a look at these areas, and I've just done a cursory look, these are the areas that really suffered horrifically from COVID, because they were from the more deprived areas. They were from the regions that had, you know, the hospitals that were already struggling. You know, it's a shame. It's awful. I'm not, you know, lining one up with the other, but I'm just looking at sort of a map of the UK, and I'm just looking who did what where and what happened to them. That's it. You know, everyone else can draw their own conclusions, but I'm just looking at it purely from a scientific perspective and looking at numbers and facts. And it is heartbreaking. And you know, the one thing that I am relieved about with the inquiry is that things like this are being said, you know, the factual side of things. I'm a bit curious as to why we're only hearing this now. And, you know, some things are coming out that I would have thought, wow, I'm surprised that didn't make the news earlier, you know, along the way.
Definitely.
So anyway, there we are. And I have to say, watching the former chief medical officer this week made me have even more empathy for Professor Chris Whitty on what he inherited in terms of a really a system that was already on very, very loose, shaky foundations, basically because of what was going on under the watch of the person that came before him.
Mm-hmm. I think we'll talk a little bit about Whitty and Balance a bit, because they were speaking today later. But Fleur, we've mentioned some political decisions there. Let's come to you. I don't want to throw you into the same ballpark as some of the people that have come up there. Have you had much time to catch the inquiry? What are your thoughts on it so far?
Well, Saleyha, I'm sorry for your loss, and thank you for hearing from you, because it's about what justice means for you and other bereaved families that this COVID inquiry has got to be looking at. What is justice going to be? What are we going to see at the end of this, whatever it's going to be, 3-year process? Are we going to get to somewhere where we have enough information? We have seen what the truth was, what was behind those decisions that had such important consequences for so many, and will be learning. It's been frustrating up to now. I agree with you, Saleyha. I've been working on this as well and trying to push the government to even do this. We didn't know if they even would. They kept on just moving it, and it seemed to be, there was so much political turmoil in the system that everyone who took it up was just hoping that they could give it on to the next person, kick it onto the long grass, have it after the general election. We didn't know what it was. So yes, in a way, to get to this stage, it is good, because it really didn't seem to be a given that we would even have this at all. And during COVID, there were some studies, there was some real-time learning that wasn't really heard as well. And I'm frustrated about that, and I hope that that comes out in the inquiry. There was a group, for example, called the COVID-19 National Foresight Group. They were doing actual real-time learning with experts who were on the front line during the day, and they were doing this at the same time, because they knew you have to learn as you go along so that your actual response during COVID gets better and learns. And we didn't learn enough then. So we should have been doing quite a lot of what the inquiry is going to do during COVID. We're even running to catch up now. So that's just some of the background to this. Everyone seems to be very happy with Baroness Hallett, and I'm very delighted that it's an independent inquiry. It's been resourced. It will have the powers as well to hear from the right people. We've been hearing that from the off, and to get that information. But then the government wouldn't give over the information. And that's a kick in the teeth for everyone who's looking at this inquiry and hoping to get to the truth, relying on the fact that they will be able to see everything. Now we don't know. It's all a big question mark, isn't it? How much has been redacted? Why did Baroness Hallett have to go to court to try and get some of the information? That is not complying with the inquiry, and that's not a good start. So then I'm really disappointed to hear that the Bereaved Families for Justice is not happy with how they've been included along the way, because you couldn't have said it more clearly from the outset about how you want to be included and how you should be. And there were other groups as well, especially those representing minority ethnic groups who were particularly affected and who are part of the terms of reference, but them not being included as well. There was a fight to get them into the process, but to have them not included is disappointing to hear. So will we see the truth? And now we're looking at the pre-pandemic. Are we going to see what I think we'll see, which is that the country was run down before the exercises that Saleyha talked about? Those really crucial simulation exercises were not carried out. And there was an exercise Cygnus, very famous exercise Cygnus in 2016, which had a lot of outcomes which, if taken up and if understood more, could have made a big difference. Why were they not? Why did Boris Johnson not go to the 5 first meetings for COBRA? And then moving on to looking at then about the actual decisions made. We're going to come see that further down the line, the decisions that were made during COVID, the decisions that were made about PPE, the very thing we were just talking about, which should have been part of our pandemic preparedness all the way through. Labour brought in the Civil Contingencies Act many years ago, and that's something that needs to be constantly updated, but really got to about 2010, and I would say this, I guess, 2010, and then it just wasn't developed. So local resilience forums were left not to be developed, not equally resourced, not equally given the same training, not all brought up to same standards. That's something that we will change. All of those things in preparation, all of those decisions, I hope we will see, and I hope that will be some form of justice. But and as a politician, I want this to be genuinely independent. So I want to be really careful what I say. I'm not trying to influence the inquiry, because it's got to be genuinely independent from any of us politicians. But I can be here observing what I've observed up to now, which hasn't covered the government in glory in terms of its information. And alongside this, freedom of information requests are really key to this, to anyone trying to find out what happened. It's very key for Ruby and Finn and all journalists trying to find out the truth. And yet this government is woeful on responding to freedom of information requests. It's on about 39%. It responds to about 39%. It's, I think, in the 20s for the Prime Minister's office, and the Cabinet Office is really woeful, and they're meant to be the ones that run it. So this inquiry has got to get in the place of a lot of information that we haven't had up to now. I could go on, but one more point I would say that Saleyha raised as well is the role of experts, because I hope what we see from this inquiry is that we don't have a narrative which does down expertise, which will be dangerous for decision making in so many areas of our lives, especially political lives for the future. But I hope that it puts expertise back in the forefront, and necessary and evidence-based decision making is what shines through as being needed. What happens when you don't have it, where it did take place, praised, but where it didn't take place, absolutely exposed, and in the lessons that we learn to bring back evidence-based decision making, because I think that's been eroded alongside our trust in politicians, has been eroded through this process. And I hope that part of the outcomes of this are restore that as well. But we have to take a good hard look at what actually happened before we can move on. And I wonder what everyone watching here thinks about a 3-year inquiry as well.
Yeah, I mean, the timeline is an interesting point as well. You know, speaking about experts, speaking about politicians, I think it's interesting watching the inquiry, maybe the difference in hearing evidence from the scientists versus hearing evidence from the politicians. And unfortunately, Fleur, you're the only politician here to represent those voices at the moment. But, you know, we've seen Hunt, we've seen Cameron, we've seen Osborne, we've seen Dowden, and on Tuesday we'll be seeing Hancock. Fleur, why do you think it's so important that ministers are open and honest during these inquiries? And do you think they're likely to be as honest as maybe they need to be?
Well, don't they legally have to be? There should be like
yes, that's why I sort of carefully worded that.
they legally have to be. That's why it's different to any other forum. This is a different one. That's the point of having the inquiry. That's why we bring them in and under totally different terms to hear that honesty. And there are various reasons why this is a good thing, and it's a good thing for us, for any politician, to know that that is what you could face for any decision you make. You have to be prepared for any decision you make to be up to the same scrutiny as faced in the inquiry. And I hope that gives every politician a pause for thought, second thought on decisions they make. That you have to be able to back them up. And we know that it was a really, really unusual time in the heat of the moment. So I hope that the politicians will be able to explain all of that, all of their thinking, why they made the decisions they made, so that we can look that, as I say, look that truth full in the eye. But it's interesting that Rishi Sunak said he wouldn't give out the information because he thought it was beyond the remit of the inquiry. It's not up to him to judge what's the remit of the inquiry. He's got to trust the process. Otherwise, we can't trust the process.
Absolutely. And I think, you know, that is essential when we're talking about justice. You know, I think we'll get onto this, and there are many ways you can find justice, but also a lot of it is about information and truth and transparency. And I think being able to get kind of honest information from the politicians speaking will be kind of core to that. Finn, just like myself, you've been down Dorland House this week reporting on the inquiry. I wonder if you could give us a little sort of taste of that. So what was kind of taking place today?
So today we had evidence from Patrick Balance and Chris Whitty. They were, and then when I was with Roger Hargreaves this morning, who was the former director of the Civil Contingencies Secretariat. Yeah, very interesting to hear from Balance and Whitty. We're obviously all quite familiar with them. We've been to our living rooms every evening. But they were talking about, both of them seem to agree that the UK had reasonably good plans in place to deal with the pandemic, but no ability to scale them up, which left us in the position that we scale up testing. Our vaccine system didn't have the infrastructure around it to scale up quickly enough. And it was also interesting hearing from Roger Hargreaves this morning. And he was actually grilled quite a lot on, he was director of the contingency, so he was how well prepared we were, and the fact that, yeah, I think professionally seemed to suggest that we just didn't have. It's all well and good having the plans, but if we don't have the mechanisms to put those plans into place, then we were really going to struggle. But earlier this week we also had George Osborne and David Cameron, who were there defending record on austerity, both of them suggesting that it had left the UK in a great place to tackle the pandemic, which was, I think, former Chief Medical Officer did pour some scorn on that, suggesting that actually we didn't have enough beds, we didn't have ventilators, we didn't have respirators. So if you kind of take some of those arguments. But yeah, I mean, I've actually listed down all of the things that we've found out so far, because there are so many.
Yeah, Finn, why don't you just chuck in, your audio isn't amazing, so I'm going to do a bit of what they do on Radio 4 here and probably like round you up a bit quicker. But do you want to just give us a few of those headlines that kind of we put out this week, the stories we've seen?
So pandemic preparedness was paused so we could plan for a no-deal Brexit. We stockpiled much less PPE for black staff in the NHS. As I said just before, there's a lack of scaling up ability for our plans. There's a lack of embedding of financial and ethnic inequality into planning for the pandemic. Lockdown is not considered in emergency plans, and yet the list is on.
Great, thank you so much, Finn. I don't know if I've mentioned, but openDemocracy are sending a reporter every single day to the inquiry. So do take a look on our website if you want to kind of keep abreast of what's happening and you can't sort of sit through hours of an inquiry every day, which is fair enough. This talk is about justice, and I think I want to kind of move the conversation to that a bit. It's worth saying that a public inquiry can't make findings of criminal liability, but of course an inquiry can lead to criminal proceedings, though that is not the only form of justice that you may want or may be satisfying. It may be quite a good one. Fleur, I just wanted to ask, I know inquiries are kind of in your remit. Are they good formats for pulling justice out? Do you think they work well? The kind of legislation around it works well to kind of give people justice?
Good question. I spent 3 hours today in the debate and responding to the debate on the infected blood scandal and the inquiry into that. So I was drawing parallels, obviously, that these two, we're kind of talking about them at the same time. And the fact that you even have to get, the fact that the infected blood scandal had to even get to an inquiry was a failure of the whole system up to then. So that's a bit different, because we've wanted an inquiry on COVID straight away, and obviously having it sooner is a very different place to having to be dragged into it after like 4 decades that they've had. It's taken a huge amount of time, and nothing would move anything until they had the inquiry, and only in the inquiry did anyone who was infected or affected, their families, get any voice in the system at all. So that's one thing, that the inquiry does give voices. Obviously Saleyha's not happy and the families are not happy about the voices that they're having, but it is far more voice than in Parliament. So that's one thing that should be there, and that should be a hallmark of a good inquiry, is that you have the voices of those who are affected able to speak out in a way that they can't in Parliament. We will speak for people, but you can't have people speaking for themselves in Parliament. So that's a huge difference, and it should be a benefit, and it should enable far more of the truth to be uncovered without any sort of anyone in between. They're very, I suppose that the powers to get the information is absolutely essential, because otherwise we will only have partial facts. So it had to be an inquiry that did this, because it has to be Baroness Haylett actually saying, I'm going to take you to court unless you give me this. And she was tested in that to the extreme right at the beginning. So we have to know all of the truth. And that all of these things are because we didn't know the truth, because we weren't hearing from the right people. I mean, it's a failure up to now that we haven't had it, so that we have to have this inquiry that should result in that. The length of it is something. We all may yet be proved wrong about this, but something that drags on that long, it's going to be news from the beginning, and it's not going to be later. And is it going to be so long that we've moved on? And so whatever the findings are just out of date. So I'm sure that Baroness Haylett's got absolutely in her mind, as is everyone on the team, that mustn't happen, and it's got to be in depth enough as well to be meaningful. But other countries, if you see, they've done it. So other countries have done their inquiries. They've come in, they've done their inquiry, they've looked at it, it's there, and then they're learning from it immediately. And that would be one of my main challenges to this process, is so that we can't wait. We are more likely to have an emergency of some sort: cyber, climate related, AI, another pandemic. It's going to be, or a mixture of those, or something we don't expect. We're more likely to have it. It's not equal all the time. We're increasing the risks that we have. Those risks are more complicated and severe. And so we have to be more prepared to respond in a multiple amount of ways, as we did to COVID. And so we have to learn those lessons early. They could come any day. We cannot wait and then learn the lessons. So I want to know along the way that is happening. But I do worry that an inquiry means that the government goes, oh, well, the inquiry is going on, we don't need to do anything about it until it finishes. But that should not be the attitude.
Okay. And Saleyha, I wanted to ask, I think
I want to come back on that first, please.
yeah, no, go for it.
Yeah, so I totally get that, and that's exactly what so many people were calling for. Can we be, the whole point of the inquiry is that we start learning lessons now after wave 1, so that when wave 2, not if, but when wave 2 comes, we're ready. They didn't. So wave 2 happened, and that's the wave that got my dad. It got many of my patients. Yes. It would have been wonderful to have started early, but we didn't. But we know why. I'm not in politics, and I can only guess what goes on in Westminster, other than what we read. But if you had a government who was clearly performing badly for all sorts of reasons, I don't feel that they were motivated in that way, and possibly in the way that other countries were, to basically learn lessons fast so that not more of our population die. And so that, I just don't feel that they were motivated and driven in the same way for whatever reason. And maybe we'll find out en route with this inquiry. The other thing is the modular system. This is one thing I think is actually useful. Baroness Hallett has divided it up into modules, and the volume of documents is huge. It's thousands and thousands of documents that are coming in to the lawyers, to core participants to be able to read. I'm party to them as well. The volume is staggering. So the fact that we are now working on a modular system, so module 1 is preparedness. This will go on for 6 weeks. It will then stop. Baroness Hallett will go away and have her thoughts and her thought process. I'm not entirely sure when she will put out her recommendations on module 1, but I feel this I think is one way to tackle the volume and the fact that there is so much to go through, and we do have to go through it all because we're only going to get this once. And as a bereaved person, as a healthcare worker, I want this done properly, because we are only going to get this done once. And frankly, so much went wrong that it's going to warrant this attention. I do hope that the government don't, whichever one it is, and where we all, I'm hoping it's a different one, as we go through. But then it will be down to the next government to make sure that they don't say that too, that we can't deal with this because there's an inquiry. So I think, yes, it is a heartsink that it's going to stretch on for so long. It does make me feel better that we are working through a modular process. It is infuriating that Rishi Sunak is now probably going to contribute to a delay in module 2 because he is acting like a petulant child by not handing over the documents, because he thinks he wants to test the system and, test the principle of handing over unredacted content, when we quite clearly have, the Inquiries Act that states it in black and white that you must hand over everything, and it's not down to you to judge. So that is irritating. That there is a tight schedule. As soon as module 1 stops, the lawyers are back on it, prepping 24/7 almost. Honestly, the hours the lawyers are working are incredible, because of the volume of content and the back and forth that's going on between the inquiry and all core participant lawyers is huge. So they will be then doing marathon sort of shifts to try and get ready for the next module, which will be in about September. So it's a really full-on diary, and there's no slack. And I don't even know where the cuts would come in time, because every module is vital.
Completely. And I just wanted to ask you, before we kind of move to taking some questions from the audience, what does justice look like for you? What would be, as a doctor, as a bereaved person, what would justice be for you from this inquiry?
I think I'd like to see people, I'd like to have a rethink of all the people who performed poorly in their positions. I would like to think that their positions are reconsidered. There have been plenty of people who have been rewarded for poor work, who have been given elevated positions, who've been given peerages, who've been rewarded for actually failing in their job, in their position. I'd like to see that readdressed. I'd like that to be, it might, you might not be able to do anything about the head of the UK Health and Security Agency now being in position, but I'd like it to be outlined where they failed and how was it that, someone that was quite questionable in quite a lot of their sort of comments and decision-making was rewarded so warmly and richly, both in position and job. I would like to see also, I'm not going to lie, I asked my lawyers right from the beginning, could this ever lead to something else? Could this ever lead to criminal investigations? I would like to see it. I'm not going to lie. I do. I saw the damage. I saw the harm. If this was any other sector, any other system, there would be repercussions. Why is there a ring fence around people who are in, positions of power that can ultimately lead to the life and death of so many people? Because that is what it is at the end of the day. I'd like to know why we had out-of-date PPE that was pinging off my colleagues' faces within a red COVID ward mid-patient move, literally, that they were old, they were out of date. We all saw the news stories of lots of different stickers being put on them to change the dates. But, in practice, these things, a sticker is not going to suddenly make it in date, because some of these, the elastic was actually pinging. They were so old in a live COVID room. So what would justice look like? I'm not a lawyer, but I really would like to test the route to a criminal process. I don't know. I have no idea. Someone somewhere must be liable. I don't know how. But I know we've only just started, and I thank the person who led with their conscience to sort of release that video of the party. There's going to be more, surely. We know there'll be more that will come out. Hopefully people will feel, that they want to sort of deliver that. So bracing ourselves for more, but it's got to stop being, oh, we'll go look at whether we need to give you a little fine, because I think for me, that's not enough. What else does justice looks like? It really means looking at what went wrong, and it means appointing people into positions correctly. I have a big problem with people I do have a problem with the UK system, where very, very little actual scientific and medical knowledge is actually within the departments that deal with it. We have got doctors who are politicians, but none of them are deputy or the Minister of Health themselves. They are in other countries. And what I find difficult, and I just when I see the scientists and the healthcare professionals giving evidence in the inquiry, and then you see and it's quite straightforward. What they're saying is quite straightforward and logical. If you're a professional from that world, it all makes sense. But there seems to be a problem with communicating that to politicians who are driven by other things, who are driven by other agendas, who have other things to think about, without really understanding what the dire consequences could be. And I suppose if you've trained as a medic, and if you have worked in a way where you have put your hands on a patient and you have cared for patients, and what it looks like face to face, eyeball to eyeball, when it goes wrong, that drives you just that little bit harder, I feel, to get it right. If you've never done that job and I don't know, you worked for a bank and now you're suddenly in charge of health. This is why I argue against senior managers of hospitals coming from having run ASDA. No, it doesn't make sense to me. I need to know that someone knows what life and death is and what the things that you need to do to really help stop suffering. And if you've never walked that route, then you're really not going to understand it in the same way. So what I would like to see going forward is a real look at who gets recruited into these positions. Matt Hancock, what a poor positioning of someone who was so clearly out of their depth in that position. And you couldn't have planned for it to happen at a worse time, frankly. And now we've got, the current health secretary now, Stephen Barclay. And again, even on a human basis, surely, if a workforce risked their lives for the country, is this how you repay them? No, it isn't. And I think they seem to lack that little element of humanity that I think I'd like to see within people in those positions.
I think that's really interesting, looking at kind of the roles in government and the people who go into government and how those people get into government. I'm sure Fleur will want to say that there is a doctor in Labour's shadow health department. Then I don't believe
I'd heard more from her, to be honest. I'm going to say I've actually tried to engage as well, but I didn't hear anything at all. But that's a shame. I wish I'd heard more.
And look, if we had a teacher in them, we'd have this whole discussion again about exactly the same, about teaching and about Gavin Williamson and his role in the inquiry. So I'm glad that's within the scope. And so discussing who is an expert in the situation, these are questions we have to ask. If we're going to be ready, seriously ready as a grown-up country, ready to have long-term political thinking, we have to allow our politicians to have long-term thinking. That's a whole shift. So that might be the outcome of this as well. And also to be able to have things like exercises without politicians thinking, we can't have an exercise because it will show up some mistakes and I will be blamed for it and I will go and therefore we can't have the exercise. We have to be able to do this as a country because we're not going to be ready for what's facing us coming down the line. There will be things we have to face and we have to have learned some really, really serious lessons. So what you're talking about, Saleyha, is an absolute mind shift about who makes decisions. We have to have that discussion out of this. And to think this was just a one-off, it was really bad luck that we faced it in our generation and the next generation won't face it and it might be for another 150 years is absolutely what we must not feel about COVID. We must feel it's going to, any day we could face this again. And we need to be more prepared than we can imagine. And that's going to need a national whole shift of how we think about emergency preparedness. And we've been talking in the Labour Party about a whole of government thinking, so that sharing the information between departments that didn't happen between regions and nations. My borough health officers didn't have the information from the national, all of that's got to be entirely changed. But also whole of society thinking as well. And that is a shift of mindset, which they've done in other countries where they face things like earthquakes, tsunamis. I was talking to an Australian politician, learning from their experience of the fires that they've got and they've had. They've had to change the whole way they do government and planning for emergencies as a result of that. We mustn't wait for another emergency before we have that kind of shift.
So I don't want to interrupt you, but I'm just conscious we have 10 minutes left and I think it'd be worth kind of dipping into some questions we've had submitted. Thank you everyone who's put them in the chat or thrown them into us beforehand. So one I'm going to pull out, which I think is quite interesting. What recommendations would you like to see that would aid us should there be another pandemic? Does anyone want to take that one?
I think I've said what I've said, but I will say one thing, and it came up with Witty today, about the abuse and the attacks that healthcare workers and scientists and experts received, both verbally, online, even amongst, behind closed doors with whoever they were negotiating with, and onto the streets. We're also aware of the awful things that Professor Whitty had to put up with. But I think the media has helped fuel that, it really has, by but then again, where did a lot of the discussions and the debates that, I was always called on to sort of take part in, well, that kind of stemmed from things that were coming from Number 10, frankly, the debate on should we or should we not be wearing masks, and should we not be shaking hands. And Jenny Harris had a part to play in that, because she backed up Boris Johnson, really, saying that you don't need to wear a mask and you can shake hands. And she is a healthcare professional, so it doesn't always work. But I think there needs to be, as Flo was saying, a whole system approach to this, a whole society approach to this. Let's just all be on the same page, because frankly, that virus doesn't care who you are. If it's going to come and get you, it's coming to get you. That's it.
Mm-hmm. And Fleur, recommendations that you might like to see?
I touched on a couple, but there's so many. A couple that I would choose of, which I hope they look at, as who's at the top is accountable. And Oliver Dowden talked about this in his evidence as well, and he would say that you need to have, and I would agree, and in fact I asked the minister today in the Cabinet Office orals, I asked it was Oliver Letwin was giving evidence, but I asked Oliver Dowden, who's the current Chancellor of the Duchy of Lancaster, I said, would they now consider having a minister for resilience, just focusing on resilience, so that, for example, something like Brexit came along and they don't chuck the whole thing out and focus on something else, just a dedicated minister. And I asked about that today, because that's something that Oliver Letwin as well has been talking about. So it's not just Labour. Lots of people have been talking about who's accountable, and a reform and a look at COBRA and how COBRA works, because that was did we have the quick decision making at the beginning? I don't think we did. And who was it who was not taking those decisions quickly? And to look at that. That would be a couple to start with.
Mm-hmm. Okay, and we've got another question, and maybe this one's for perhaps me and Finn to pick up, seeing as we've been doing a lot of the reporting. Do we know when the government
Can I just say very quick
of course.
Recommendation? It's really important. Recommendation: stop shortchanging the National Health Service. We are not in a position to cope with the next wave. And as Fleur said, it's not if, it's when. And I know this myself. I work in the disease dynamics unit in Cambridge. It's not, and climate change is fast tracking everything. We've got diseases in Europe that we haven't seen in Europe for many years that are vector driven by climate change. So we don't have that long. And I would say recommendation: sort out the inequalities within the health service, stop shortchanging it, bring up the funding to where it should be, pay the workforce so they stop leaving. But that has to be a priority.
Absolutely. And just this question, Finn, do we know when the government were first warned about the dangers of a possible pandemic? I mean, something I can add from watching the inquiry is we know that the UK government had a lot of information and had done a lot of research on preparing for a influenza pandemic, and that had been around for a while, and it had not spent nearly enough time on a coronavirus pandemic. Finn, I don't know if there's anything you wanted to add on that.
There was also evidence which came out on Tuesday, I think, which is that the government had seen after exercise, ALICE or sickness, which is one of these preparation exercises, there were recommendations that we should improve our quarantining and contact tracing. These were given to government and they did not take them into account. So I think, it's important that we learn from this inquiry in the way that we didn't learn from previous exercises.
Absolutely.
Someone's put in the chat box about care, residents in care being able to see their families at all time. That I would absolutely agree with that, the impact that made. And I would hope there'd be recommendations on schools as well, and what we would do to stop the detrimental impact. And then also businesses, and so many businesses being left out. And then you've got the fast track lane. You have a community-led, not crony-led response to the pandemic. There's a list. There's so many things.
Yeah, so we've got about 4 minutes left. I'll pick out another question. I think, Fleur, this might be interesting to you as well, just because of your job, your work before being a politician. What can both groups, such as COVID Bereaved Families for Justice and the inquiry itself, do to maximise the chance of recommendations being implemented and helping achieve justice through policy change? So I guess that's the question of how do you, I guess, as an individual and also as an inquiry, actually see policy changes as a result? How can you effectively lobby government, essentially?
Who's that for?
Fleur, Saleyha, do either of you want to jump in?
To make sure we listen.
Yeah.
Well, I have faith in the inquiry that it will come out with clear recommendations. It will get to the bottom of things. They will listen to families down the line. So I want to have extreme faith in the inquiry, and therefore there's no reason not to trust it. There's no reason to dismiss it. You have to listen to it and you have to take it seriously. And then there have to be, just like any company looking at evidence and deciding what to make, there has to be an action plan. It has to be put in place. But I hope that also people will keep watching it. I hope Open Democracy, that you're doing will be part of this as well, to lead to a general discussion where politicians are able to make a different kind of decision. And that is a shift, not just of politicians, but also of how we talk about pandemics, emergencies, being ready. So the challenge is on for being able to not bury this inquiry so no one finds out about it, but keep it alive, keep learning from it, and so that politicians have to act, but also they have this kind of the society shift that we need to have as well. They're very big, but it would also come down to lots of small things that can change and are changeable and achievable, like care homes, visits, looking at different aspects.
Can I just say, add on to that, I think that not looking at care homes until 2025 is just wrong on so many levels. We have got a couple of winters before, we've got winters before then. We have got, the seasonal illnesses that we sort of brace ourselves for. We start in A&E and within healthcare start bracing ourselves for in the summer, looking ahead to winter. They're bad. And, I don't understand the logic of waiting into 2025 for care homes. They should be a priority. They should be right there at the top, within the first year or 18 months, so that we can start to implement those changes. I saw that firsthand. I was in the A&E room, watching nurses having to call up care homes to say, I'm sorry, I can't test before I send back. It was shocking. It was hard for both parties. And there were senior management almost micromanaging every step to make sure that these bizarre rules were adhered to. I've never seen anything like it. It was horrendous. Okay, not all of us adhered to that. I definitely tested anyone that I was sending back, but I didn't care. But if you're a junior nurse and seniors have told you, I witnessed it. The phone calls between a really stressed nurse and a scared care home manager, something that I'll never forget, and I never want to see that again.
Absolutely. Well, we've kind of come to the end of our time. I can see someone saying we need a webinar re care homes, and I think that's a really good point. I think Open Democracy recently was handed a document that the Department of Health had kept secret, that was from September 2020, about lessons learned. And some of the things in there were shocking. It mentioned that the Department of Health just thought care homes sort of had their own resilience preparations and kind of thought they were an extension of the NHS. And you think this is the literal government department that's meant to be dealing with health and social care, and it didn't know that. It didn't have the experts. So I think that's definitely something we can leave potentially for another conversation, and there's a lot to be said there. Thank you so much, all my panelists for joining, for our panelists for joining us. And, I really appreciate it. And obviously I will plug Open Democracy in our reporting. And if you want to take a look at any of the stories we mentioned, that's on our website. And I hope everyone keeps listening to the inquiry and keeps asking the questions. And I hope that we get the justice that everyone deserves. So thank you again, and have a great Thursday.
Thanks, everyone.
Bye.
See you. Bye.